Welcome to the Sheila and Eric Sampson Pavilion, the home of the Case Western Reserve and Cleveland Clinic Health Education Campus. You're looking at a structure that's been completed over the course of the last 4 years. It's the combined effort of over 2,200 engineers, architects, planners, tradesmen. They've all put their hands and their work together to create a home for tomorrow's caregiver, to train, to learn. We're excited to have you here today. I'm going to conduct some interviews with some of the key players behind the project. Come take a walk with me. Well, I'm here with Lord Foster, who's here to help us open the Eric and Sheila Sampson Pavilion. Lord Foster, what a phenomenal design. We're so glad you're here today on opening night with all of our VIP guests. Thank you for coming.
Pleasure.
You know, I'm reminded that you and your team helped us master plan the Cleveland Clinic campus. Could you ever imagine when we did that work that we would be putting a structure such as this in this location?
It's a fantastic occasion. I mean, to see the realization of a dream. And we started with a master plan.
Indeed.
And the master plan was about a green spine. It was bringing nature and using nature to bind together all the diverse elements that comprise Cleveland Clinic Case Western. And this, in a way, is like that master plan in microcosm.
Indeed. Indeed.
Because it's about nature, it's about daylight, greenery, and bringing everything together under one roof, which is radical, and we're not aware of any other example where under the same roof you have doctors, nurses, dentists, training, working together.
One of the things that runs through all of our work, I certainly ran through all of Foster's work on that side, was the idea of breaking down silos, trying to get people to work more closely together. And I think that really starts with education, because if you can crack that in education, it runs through the whole of professional life. So really what we've tried to do here is to create a building that really curates the conditions under which education can evolve, and students can find a way to use it that may be completely different to the way that we've seen to date.
Why this building is so extraordinary is that it's the first building that has created architectural form to allow interprofessional education and bring not just medical students together, but also dental medicine students and nursing students. We rely so much on all of the healthcare professionals. Training them under one roof is really an extraordinary experience, and doing it with a design that allows extraordinary interaction, unbelievable information technology that can come in, unbelievable audio-visual presentation,
Right.
and the ability to work together in small groups and with people from the other schools, the other professional schools at CWRU. It's extraordinary. The bottom line is to produce a much different, a much more competent, empathic, skillful team of healthcare providers.
I can imagine 2,500 students in here experiencing this building and experiencing this tremendous opportunity you and your team have conceived. And it is so full of light. It's so active. Talk to me a little bit about your impression of these staircases and the connectivity that they allow for.
Well, it is about connectivity. It's about breaking down barriers between different disciplines, and to create a feeling of spaciousness. So by stepping back as terraces, then everybody gets the view into this space, and you also have the feeling that it really is spacious. It actually feels bigger than it actually is. And so sustainability aside, given at times the hostility of this climate, it's also, in climatic terms, very appropriate.
Well, thanks for joining us on today's tour. It's been a privilege to take you around and see all the fine work that's come to putting together this health education campus here at the Eric and Sheila Sampson Pavilion. We're so proud of what's been accomplished, but we're excited today as we cut the ribbon to open up this place for tomorrow's caregivers. Let the training begin.